Muhammad Ali Fateh, the Coordinating Minister of Health, the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, and other members of the Honorable Minister Entourage to Borno State. Let me begin congratulating Professor Fateh for his well-deserved appointment as the Coordinating Minister of Health. I have no doubt in my mind that you will turn around the fortunes of health care in the country, judging by your experience and track records of service. I am particularly delighted to receive you and for your entourage at the Government House at a time we are trying to put everything in place to reposition the health sector. My administration has given top priority attention to health care in view of the numerous challenges of the sector and occupies a prime place in my 10-fact agenda to the people of Borno State on assumption of office as governor in 2016. The Honorable Minister might be quite aware that Borno State, being the epicenter of the over a decade of the devastation of insurgents in the northeast, more than 40% of the health centers were destroyed and complete disruption of services. The government has to face these challenges squarely in order to systematically build back better the sector. In this regard, government produced a 25-year strategic development plan and 10-year transformation initiative. The rebuilding processes of the health sector are being pursued vigorously along these plans, which include construction, reconstruction, rehabilitation, and renovation of health facilities across the state. These are followed by ensuring functionality of the facilities by providing human resources for health equipment and essential drugs. Honorable Minister, it is worthy of note that my preoccupation in the sector now is system strengthening to make it result-oriented. I'm quite aware that if services at the PHCs are given the desired attention, most of the challenges of the sector will have been solved. This administration, having realized this, and therefore prioritized primary health care. Accordingly, government has constructed, reconstructed, and equipped at least 80 primary health care centers in Borno State. Bearing in mind that there should be at least one PHC per ward. Employed over 2,000 health personnel within appropriate academics, drugs including free drugs and consumables for pregnant women, mothers and children under 5 years of age are provided. Recently, over 800 million worth of free maternal drugs and consumables have recently been procured. And replenished in stores and are being distributed across the health facilities. This is for this year. Since I assumed duty as the governor of Borno State government has been providing free maternal health care delivery system to the less vulnerable in the state. To strengthen this stem, a law establishing the Drugs and Logistics Management Agency has been signed into law. And very soon, the agency will come on board. This modest effort of ours to reposition the sector for quality, accessible, and affordable service delivery has earned the State Board Zonal and overall Best Awards in the Emerging Leadership Challenge Fund. Honorable Minister, this is not to say that the secondary and tertiary health care aspect of the sector are ignored. The secondary health facilities, specialists, and general hospitals have been constructed, rehabilitated, and equipped. The state specialist hospital is being given facelift and expanded to accommodate more patients. Borno State University Teaching Hospital is nearing completion, and we hope you will have time to visit the teaching hospital undergoing construction. Government is also mindful of the sustainability of the strides, particularly the human resources for health. Hence, the establishment of 2 colleges of nursing and midwifery at Koza and Mongono respectively, in addition to the College of Nursing and Midwifery and that of Health Technology in Maiduguri. The Borno State University has commenced courses in medicine and other allied fields. Foreign Minister and his entourage might also be interested to note that the sector has been adequately responding to challenges posed by incessant disease outbreaks, such as cholera, polio, COVID-19 pandemic, Lassa fever, meningitis, and now diphtheria. The state has a robust outbreak response system in place with best of coordinating facilities, a public health emergency operation center, and that of polio. It is pertinent to mention here that the state cannot do all this alone without acknowledging the supports from the Federal Ministry of Health, National Primary Healthcare Development Agency, National Center for Disease Control, and partners. The collaborations have been very remarkable, and we can only crave for more supports. And therefore, I want to seize the opportunity of the Minister's visit to request for more support to the sector, particularly in the areas of medical emergencies and referral services by supporting the state with ambulances, upgrading of our public health molecular laboratories, allocations of more vaccines for outbreak responses, establishment of federal medical centers, amongst others. Foreign Minister, ladies and gentlemen, with this remark, I want to sincerely appreciate and thank the coordinating minister and entourage for finding time to come to the state for the condolences visit to the state, to the people of the state over the sad loss of our illustrious elder statesman, Professor Omar Shaw. While making your remark, I've listened attentively to the four major reasons why you are here. One is to commiserate with us over the demise of Professor Omar Shaw. And on behalf of the government and people of Borno State, I want to express my sincere appreciation to you. And secondly, you said to me that you are also here to thank me for all the support that we have been rendering to the teaching hospital. I don't think this is needed because the University of Maiduguri Teaching Hospital is supporting who? They are supporting the people of Borno State. Majority of those that are receiving attention from the University of Maiduguri Teaching Hospital are indigents of Borno State. So there is no distinction between federal and state institutions in terms of providing affordable and quality healthcare delivery to our people. And therefore,